Welcome to a new edition of South Sound Business Report, when we'll introduce healthcare champions for 2011. Stay with us. Hello, I'm Jeff Rounce. In each of the past 4 years, the Business Examiner has recognized outstanding medical professionals from the South Sound. We call the program Healthcare Champions and have observances in both Olympia and Tacoma. With me today is Dr. Cole Mason, a pediatrician who recently semi-retired after a quarter of a century.
About 35 years.
Outstanding. So now you have time to serve as president of the Thurston-Mason County Medical Society, as well as, I understand, you're providing vacation relief for other physicians?
That's correct.
That's a great thing. Yeah. At the far end of our desk is Brad Berger, an owner and managing partner of Cornerstone Financial Services based in University Place. And Cornerstone was the sponsor of the Pearson South King County Healthcare Champions event. We appreciate both of you being with us today. And Doctor, your connection to this effort is quite obvious, but I'd like to start with Brad, if that's permissible, because it's a little less clear why your firm, a financial planning service, would see Healthcare Champions as a program that was worth linking to. Brad, what's the background there?
Well, I think there's a couple of items. Number one, we draw a lot of parallels between what we do in the financial planning community to what happens in the world of healthcare. One of the things that we often refer to our clients when they ask us to take certain action on things, we use a term that is prescription before diagnosis is malpractice. And the reason that we like to use that and emphasize that is we want to let the client know that there's a tremendous amount of background information that we need in order for us to develop the necessary planning before we start to implement specific plans of action. And one of the things that we find is oftentimes missed in the financial services community is that detailed background information, the testing that would happen in a physician's world, the detailed questions and the background that you need before you can actually start treating the patient. So that's one of the things. And we also recognize that for many of our clients, and we tend to specialize in far less of the accumulation phase and far more of the distribution and legacy phase of life, that individuals are living longer. And so we're interested in not only helping those individuals with regard to their financial situation, but also encouraging them to enjoy quality of life. And part of enjoying quality of life is healthy lifestyles. So we really see a great tie-in between what we do and the efforts that we want to provide for our clients and healthcare champions.
Great explanation. Dr. Mason, from the physician's point of view, can you offer a perspective that makes sense of this community-wide recognition program?
Sure. I think one of the most important things in relation to healthcare is the fact that none of us in healthcare are really trained in business principles. We went to medical school. We essentially had no training during medical school. And so sometimes we see problems in the delivery of health care that we need to address. In fact, so we address those issues. We sort of plan to fix something, whether there's not enough health care delivery around dental care, around homeless people, that kind of problem, that we then make a plan, try and get it accomplished, and it is the accomplishment of those things, whether it's small or in large programs, that these champions really have succeeded.
Outstanding. As part of our program today, we'll have video vignettes about a number of this year's healthcare champions. The first one is Dr. Jon Peterson, recipient of a Healthcare Safety Net Award for creating a team of providers for students called TOPS to offer physical exams so youth can participate in high school sports. Let's watch.
The TOPS program is a large group of both medical practitioners, including subspecialties in cardiology, orthopedics, physical therapy. We also use a substantial number of nurses and also other medical technicians, along with staff at both Capital Medical Center and some of the practices here locally.
With his relationships in the community, he's able to I mean, the doctors are willing to give up their Saturdays, and a lot of them is even more than that. He arranges for all kinds of specialty physicians, cardiologists, orthopedics, PT, cardiology, ears, nose, and throats. And so all the students come through, it's free. They get a very intense physical. Everybody gets a height, a weight, a blood pressure, EKGs, and now we added concussion testing, baseline testing.
This has allowed us to reach out and, in a volunteer basis, provide medical assistance to sometimes individuals that don't have access to good health care, and provide a comprehensive physical to hopefully screen out any type of abnormality, injury, or something that would lead them into an injury in the upcoming season.
We should note, as Dr. Peterson did, that Capital Medical Center and dozens of other medical professionals make this TOPS program a success. Dr. Mason, is this kind of cooperation common in the healthcare world?
Well, I think you can see from all of the healthcare champions that none of the programs would exist were it just for one person. So yes, the cooperation needs to exist amongst lots of different providers. Again, one person may see a vision of what the problem is, how to solve it, and then gather the forces, if you like, gather a team to make it successful. I think even at our award ceremony, everybody spoke about the fact that they couldn't really do without their team. It really is a very cooperative kind of venture to get solution to this type of problem.
Let's visit with another one, and that would be one of the healthcare champions in Pierce County, Dr. Patrick Hogan, who's a neurologist, and he's used his specialty in brain functions and nerve work to care for thousands over the years. Let's watch this vignette.
People often ask me, why as a neurologist are you so involved in tobacco control? Isn't that something that a pulmonary doctor would do? Well, tobacco addiction is a brain disorder. It truly is a neurological disorder that causes people to use a product that is killing them in so many ways throughout their whole body, but as a result of the effect of nicotine addicting the brain. So it really fits with my ideas of how to act as a neurologist to help others, and we now know so much more, as you're saying, in the world about what is actually happening in the brain as someone who's addicted to tobacco, and how do we actually what the strategy should be in getting people lifelong free of tobacco.
And there's another amazing healthcare champion. Brad, what did you learn about Dr. Hogan's long career in public health issues?
Well, I think what's fascinating about that is that the connection that a neurologist would be involved with smoking cessation sorts of programs. I think that's the part that is most interesting about that, as well as his absolute passion for what it is that he does.
Dr. Mason, there must be other examples of physicians who you know that take almost an ownership of an issue and really galvanize the community to resolve it.
Yes, two sort of come to mind. One is Gary Gowin's work with an organization called Physicians of Southwest Washington, which is a provider type of organization, and as well one of the doctors in the Thurston-Mason County Medical Society working with the Mason County boards in relation to health and particularly biomass issues and whether or not that's sort of economically viable versus medically health-wise
unhealthy for a community, perhaps.
Right.
You bring up Dr. Gary Gowin. Let's watch his conversation about the Distinguished Service Award.
In the 1990s, many physician practices were being purchased by larger groups. And the driver for that was that insurance companies wanted to contract directly with large groups, in fact, exclusively. And that was a threat to the individual practice of medicine. Some of that started to happen in Olympia, at which point a small group of us got together and began to discuss how we might organize to represent the individual practice of medicine. I think the thing we feel most proud about is that we've won the trust of the physicians in our community, and virtually nearly every physician is now a participant in PSW. And we have great relationships with both of the hospital systems here in town. So I think this building a culture of trust, cooperation, and actually excitement about our capacity to be the ones that direct the decision making about healthcare for our patients. And clearly we know that the best of healthcare happens one-on-one in small offices.
Well, I am aware of Dr. Gowin having won a state wrestling championship when he was in high school. And I think there's a crossover between the success that Dr. Gowin has had with Physicians of Southwest Washington and that state wrestling championship, and that's the hard work, dedication to detail, and willingness to just go the extra mile, so to speak.
In recognizing this organizational effort to form a physicians group and even to sponsor its own insurance plan, as Dr. Gowin's organization has done, it's really moving us more to the business side of medicine. Dr. Mason, is healthcare, is medicine a business?
Well, I don't think you can operate medical care without recognizing that at some level it is a business. Despite the fact that, as I mentioned before, we're not really trained in doing business, so we develop a team approach and have business people whom we work with so that we can get those goals accomplished. And yes, he was certainly a prime mover in Physicians of Southwest Washington and continues to be. There are other examples as well. The Vantage Physicians, who also were feted as the awardees of the healthcare champion this year. They presented a sort of different business model.
Well, we've got a video that includes both of these doctors. Let's let them explain their work, and then we'll talk a little bit more about it.
Well, Vantage Physicians uses a different paradigm for taking care of patients. Instead of having insurance be the way that we get paid, we actually have patients pay us directly. It's called direct patient care, and it allows us to give people in the community a different option for how to get their medical care, but it also gives us a chance to have less overhead and therefore be able to take care of fewer patients. Each patient then gets more of our time and energy.
Initially, we thought that we might be only seeing people who had money to burn. They might just have extra resources and decide that they wanted that high access to their physician. They wanted to have the luxury of extra time. And to our surprise, what we found was that this practice really appealed also to people who had no insurance at all.
Patients can call us anytime they really need us or email us, and it allows busy patients to have contact with their doctor 24/7. What we found is that when they know they can get us, they don't call us that much.
We do have more time and energy left over at the end of the day to volunteer. And so both Dr. Ritchie and I are involved in local free clinics and volunteering in other capacities.
Well, that's really an interesting, even an innovative new approach. Dr. Mason, within the community, or particularly the medical world, the physicians, how is this Vantage practice being received?
Well, I think now quite well. Initially, like lots of things initially, there was some suspicion, some doubt, some maybe jealousy, some not understanding exactly what their purpose was and would it meet the needs of both needy as well as well-to-do patients. It turns out now that they have a panel of patients that represent the wide range of incomes, so that they are available really to anybody who wants that type of personal relationship with a physician. It's not that people don't get personal relationship with physicians who are employed in other settings. It's just that they chose that particular model and seems so far to be working pretty well.
And in their comments, they were saying that they were learning. It wasn't something that either of these doctors had personal experience in, but they found that it's meeting their needs and it's allowing them as individuals, as members of their own family, to be able to deal with their family, and support their children, as well as provide volunteer support in other ways in the community. It's a
Right. It's almost like they have more free time, something we all covet, more free time to donate their time to free clinics.
Brad, your world is more of the business and more of the entrepreneurial, probably supportive than we might think of the traditional medicine. Is it like what we see happen when an entrepreneur takes a risk on a new idea that hasn't been proven and just goes for it?
I think so. I think there's obviously we have some issues in our healthcare system that need to be vetted. There are a number of different ideas, and I think it's going to take the creativity of business. But I also want to make sure that people understand that business is not always cold and calculating. There are a lot of businesses that provide a tremendous amount of care to their clients, to their customers, and that's no reason why that certainly can't be a hallmark of the healthcare profession as well.
Does it seem that doing things differently is likely part of the solution for our nation's healthcare problems that we're facing?
I think certainly exploring some alternatives to the way that we're doing things now. There's the famous quote that if you keep doing things that you've always done, you're going to keep getting what you always got. I think that's really going to require some innovation and some breaking of the rules and looking at some different alternatives to provide the solutions that we're all looking for.
Brad, there's another extremely powerful, newer idea that we'll visit next called Bridges, a Center for Grieving Children. And we'll be visiting with the operators of that program. Can you give us a nutshell to get this set up?
Sure. I happen to have some personal experience with this as a widower and somebody who lost their spouse very young. My teenage children, after going through individual counseling, transitioned into Bridges. This was an opportunity for them and me to sit down with groups of like individuals. So they tend to group the children away from the parents, but then also with individuals who had similar circumstances. So individuals who maybe dealt with a cancer patient versus a group of individuals who maybe lost somebody in a traffic accident. Mm-hmm. And the same thing. So it's an opportunity for the children to get together. There's some group time that's done and some fellowship time that's done, and then some individual breakouts that are done where the parents get to communicate with other parents who are in similar circumstances, and the children have an opportunity to do the same.
We'll talk more about it, but let's learn about Bridges in the words from the 3 staff members who were captured in a Healthcare Champions vignette.
When Bridges first started, a lot of the activities that groups did were all, like, feelings were the focus. So activities were all designed around feelings and how do we process our feelings, and how do we express what's going on inside of us, how do we cope with those. And we've learned since then that grief is much more dynamic than that. And so now we work with families around processing their story. What are those pieces they understand? What are the questions they still have? How has the family changed? So we look at changes from before and after, changes in ourselves before and after. How do we look toward the future, remembering that person and knowing that relationship will stay the same?
The majority of the work we do here at Bridges is groups, so really believing that it's important for both the kids and adults to meet other people that are grieving, maybe in different spots in their grief, but certainly knowing that there is some magic in allowing other people to get to know folks that are in similar situations.
We have a group for the parents and separate groups for the parents depending on the relationship with the person who died. And we really believe in the whole family getting help for their grief, and so we do help the parents.
The Bridges program has fielded inquiries from a number of places around the country, even in other parts of the world, because its work is so innovative and unique. And a number of those persons and families who have been served by the program have actually come back and are now volunteering, and that just is a great way of carrying the program forward. It's a need in many parts of many communities. At the other end of the age continuum are senior citizen neighbors, and there are more of us around. We found another healthcare champion in Wesley Homes and its Chief Executive Officer, Kevin Anderson.
Wesley Homes has been an organization that's been around over 65 years and has a tremendous history. Throughout that history, it has grown and evolved. Caring for seniors is a business, but we like to think of it as a mission and ministry as well. And without great people, you can't provide the quality care which we need to do. And in fact, the #1 premise in our scenario plan is that we will be judged in the future by the quality of care services of which we deliver and not by the bottom line.
The healthcare community, and all of us are active participants in it, like the rest of our society, is facing a growing demand for services in elder care. Can you see a model that, that may get us to a resolution, Dr. Mason? I know you were in pediatrics, but we're all a part of this whole society, aren't we?
We are, and as I get older, I'm becoming more of a part of it, and less, I guess, of a part of pediatrics. But I see various models all the way from places like Panorama or the Wesley Home to just individual living with family. It's going to be a big issue because there are more and more of us who are getting older and older.
Is the growth of senior citizens a major factor in what has broken the American healthcare system, or is it really just the fact that our technology and the related costs of investment and research and everything is moving us toward a necessary change?
Yes, yes, and yes. It's everything. I think it's there are more people with more need. I think there's more people with more expectation of need. We differ, I think, significantly, for example, in our expectations of what our health care is going to deliver compared, for example, to other countries in the world, including Canada as well as England. So, yes.
Okay. I didn't pretend that we would find solutions to the healthcare problem in this 30 Minutes program. We have time for just one final video vignette on today's show. And we want to share the Distinguished Service Award in Pierce and South King counties, which was presented to Dr. Frank Senecal of Northwest Medical Specialties.
I think the thing that helps me the most and the thing that energizes me the most is really my patients, is the interaction with my patients, the relationship that I develop with them. That's the thing that is so empowering and important to me. If we can detect certain kinds of cancer at an early stage, the cure rates are 100%, and that's true in breast cancer, nearly 100%. It's even true in lung cancer. If we can detect lung cancer at an early stage, it's eminently curable. The same is true with prostate cancer, colon cancer. Really, there's no question that early detection is what it's all about. So screening is important, and then that whole concept of prevention is important. What are the things that cause cancer in our environment? What are the things that we expose ourselves to, whether it's diet or something in our background that exposes us or increases our risk to cancer? How can we avoid those things? Are there certain things that we can do to adjust our lifestyle that will reduce our risk? And it looks like there are. All of this is very exciting. And there is a reduction in the incidence of cancer in the United States. And we think that that really these prevention approaches are very important to that. Well, it used to be 30 years ago when I started out in medicine, it used to be that really physicians worked to a large degree independently and on their own, that there wasn't a great deal of collaboration. But you know, in all areas of medicine now, it's important to have a team working with the patient. And so in oncology, we need that surgeon, the pathologist, oftentimes the radiation therapist, and the medical oncologist working very closely together in order to have success. So having a team of physicians that can communicate well and communicate well with the patient is absolutely critical, and the outcomes are definitely better. It's more fun, we learn more, and we have more success.
Like all of this year's healthcare champions, Dr. Frank Senecal is truly an outstanding member of the medical community. Brad, you have observed even personally.
Sure. Dr. Senecal was oncologist for Teresa on 2 occasions, one in 2003 for her breast cancer, and then just recently in 2009 and 2010 with regard to her liver cancer. And I have never met an individual who, given everything that he has to deal with on a day-to-day basis, is as positive of an outlook, but also the caring and compassion at which he delivers care, whether it's going to result in a cure, which it did for Teresa in 2003, or whether you're going to face a situation where you have terminal issues to have to deal with, as we did in 2010. It's just phenomenal individual, and I think very, very deserving of the accolades that he received.
Dr. Mason, how does the medical professional maintain a positive outlook in the face of challenging certainties sometimes?
I think some of that is just the positivity of the individual, in the sense that that is their sort of personality. As a pediatrician, we saw a lot of very young children with their own personalities already, even to some extent at birth. So how do they then play it out, and what do they become, and how do they take both, how do they grow in that, but also take sustenance from the patients? It's an interesting and diverse sort of experience for folks.
Outstanding conversation and terrific stories. Thank you, Dr. Cole Mason, President of Thurston-Mason Medical Society, and Brad Berger, who's a managing partner and owner of Cornerstone Financial Services. We're back again next week with another South Sound Business Report. Invite you to be here as well. Tune in the same time and channel, or watch anytime on the internet at businessexaminer.com/SSBR or kbtc.org. Thank you.